If you're from the United States and you're 65 plus, Medicare may be on your mind. And in 2023, I had Ron Elledge, and he is a Medicare Advantage expert for expats. He was my most popular interview. And so I'm bringing him back on the channel because in January, you have another opportunity to change things with Medicare Advantage. So we did the initial video in the fall when it was the annual enrollment period, but there's other opportunities to join Medicare Advantage or sign up for Medicare. So we're going to cover a lot of the ground here with Ron. A lot of the questions that came up in the comments of the last video, we're going to be covering those and just talking all about Medicare Advantage plans for people who are living in other countries. And that's the very specifics of this video. But let's get Ron on and welcome him back and also have him explain a little bit of his credentials. So thanks so much for being back, Ron.
Hi, Brighton. Hey, thanks for having me back. The last time I was on with you kind of filled my card. So it was popular. You say we were popular on your side. We were also popular on my side. And I really appreciate you having me back on. My name is Ron Elledge. I've been working in the Medicare field for about 17 years now. I don't deal just with Medicare Advantage plans. I also do supplements and Part D plans. So I work the whole gamut, but I do focus on Medicare. For the last 7 years, I've been working with international living. 5 years ago, I wrote a book called Medicare Made Easy: What Expats, Frequent Travelers, and You Need to Know. That's been a very popular book. I have studied because my wife and I have been traveling internationally and living internationally at times for the last 23 years. And so we had to figure this out when we turned 65, and it's been very natural for me since then.
Well, thank you so much for sharing all of your knowledge here with Gen Mex. So let's start out with the first question is, why are we doing this video in January?
Well, January is kind of an interesting time. It's one of the only times that people who are in a Medicare Advantage plan can return to original Medicare if they want to. It's the MAOEP, or the Medicare Advantage Open Enrollment period. Don't let that get too confusing because it may be the open enrollment period, but if you're on straight Medicare, you still can't join a Medicare Advantage plan during that time. You can only join during the annual enrollment period. But people that are on Medicare Advantage plans from January 1st to March 31st can switch between Advantage plans. And where this really becomes important for people that we're talking to right now is there are a lot of people that kind of procrastinated during the annual enrollment period because they had an Advantage plan. Now they're getting ready to travel, or they're living in Mexico, and they're finding that their Medicare Advantage plan really isn't the one they need for out of the country. And this is a great time because during these 3 months, January, February, and March, you can investigate the Advantage plans, and you can switch from one Advantage plan back to another one that will have the right coverage for where you're living and your overseas lifestyle.
Yeah, and I think you bring up a good point there that we're going to talk more about the controversial aspects that came up in the comments. But, one person mentioned in the comments that Medicare Advantage is being sued. And I think my comment was like, well, Medicare Advantage is like, you can tell us the number of plans that are Medicare Advantage plans, but I'm guessing one, got sued, but that's like saying car dealership is being sued or something like that. It's too big of a thing. The connection I'm making here is that there are many, many different Advantage plans out there with many, many healthcare providers and many, many flavors. So tell us a little bit about those distinctions between Medicare Advantage plans and what's offered where, depending on where you live in the U.S.
It's really interesting. First, let's look at that comment that you had mentioned it to me, and we have detractors. But listen, I do Advantage and I do supplements, and I know when to use one and when to use another. And I will tell you that supplements and Medicare Advantage plans have almost identical ratings with the clients. They're all in the mid to high 90s. People are satisfied with Medicare. They're satisfied with Medicare Advantage. And yes, there's been complaints, but I want you to know there's also complaints and lawsuits from time to time that hit the carriers over something that happened with a supplement plan as well as with an Advantage plan. So you got to be careful and not isolate an area and then go off on it because you're angry with one thing or another. It's true that few agents understand the specifics of how successful it is and how you use successfully and safely a Medicare Advantage plan for overseas living. However, Advantage plans are the tightest regulated portion of Medicare, and that is by a mile. You see, you can change a supplement plan any time of the year, but Medicare Advantage plans can be changed only during specific times of the year, and they have very clear directions and they have very clear regulations on them. Just look at the education. In order to sell a Medicare Advantage plan, you have to go through what's called the AHIP, the America's Health Insurance Plans. It's a standard program that you have to go through. It's about a 4-hour course and test, and you have to do that every year to be able to even offer Medicare Advantage plans. You don't have to do that to sell a supplement. You have to undergo specific training then with every carrier for every plan that you're going to represent, because they want you to know what you're representing and be able to present it honestly. You can't legally contact anybody by phone or drop by without permission to talk to them about a Medicare Advantage plan, but you can phone call and you can drop by for a supplement plan. You have to have a scope of appointment. This is a one-page document that details what you're going to discuss in any upcoming appointment. And Brenton, that has to be signed 48 hours before the appointment. Now, there is a regulation that if you call me and I receive an incoming call, I can do a verbal scope at the time because you're the one that is requesting it. But it keeps you safe from me coming after you, I guess. Here's the crazy one. Starting this year, every conversation about Advantage or prescription coverage must be recorded, and it's got to be available to CMS and the carriers. I can talk to you all day long about Medicare supplement plans and other parts of Medicare, and never have to record anything, never have anything that is ever recorded. But when I cross the line and start talking about Medicare Advantage, it has to be recorded so that it can be overseen by CMS, the Department of Medicare Services, and also the carriers that I'm working with. So it's a crazy thing. None of these precautions are in place for Medicare supplement plans. And that's why every study taken, whether it's Advantage plan and their approval ratings, or whether it's for the supplements, overall, the clientele are satisfied in the 90%.
Well, this is great to hear, especially, these are private insurance plans. So you are essentially working with the government, but they are now maybe outsourcing your care to a private insurance plan. It's very similar to what most people are used to when they were employed. Is that they got insurance through their employer. So this is very similar, and you actually might get something really similar in terms of the same provider. If it's Kaiser or if it's, Blue Cross Blue Shield, they all offer Medicare Advantage plans too. So, but I want to go back to another thing that you mentioned was people who are on Medicare Advantage can switch to original Medicare during this period if they wanted to. And that was something that came up in the comments too, is that don't do Medicare Advantage because you'll never be able to switch back to original Medicare. So that was another thing can you address that?
Yeah. And that is something that we do have to be careful with. Here's what they're looking at, I think, is Medicare Advantage. When you go into a Medicare Advantage plan, it is a contract for a year. But we also have the time during January through the open enrollment period where you can leave your Advantage plan and go to another one, or you can leave your Advantage plan and go back to original Medicare and pick up a Part D, a drug plan, because drug plans are usually in your Medicare Advantage plans. Now, here's the issue that people may run into at times, and it's not the Advantage plan, it's the supplement. The supplement will very possibly turn you down because they will want you to undergo underwriting in order to get into their plan, because they're selective so that they can keep their income high and not have a pool of people that are really, dragging it down. And so they're real careful who they'll let in after the initial enrollment period. Where with the Medicare Advantage plan, they'll allow anyone that's breathing, that's over 65 and that is qualified, they'll let you go in and out of them as they're regulated and without an issue. So during this time, yes, you can go back to original Medicare anytime you want. I mean, during this time, anytime, any year.
Well, good. So really, what I'm hearing there is that the potential problem might be if you are in poor health. Switching back to original Medicare could be difficult because of the supplement plans. Not because original Medicare will take you back, but you need a supplement plan to make it a little more affordable.
Exactly.
Is that correct?
Just to keep one thing on the even playing field, you got to realize Medicare supplements are also private insurance that is sold by private carriers. It's no different in that way. The only difference is the way it's billed. When you are on a supplement plan, your doctor has his main contract with Medicare. He bills Medicare. Medicare pays their part, then sends the bill to your private carrier, and they pay their part. Where with the Advantage plan, the doctor has his contract with your Medicare Advantage plan carrier, and so your Medicare Advantage plan is primary.
Yes. And the location availability of your doctor, I think, is another thing. When you're in a supplement plan, I'm assuming with original Medicare, you can go see any doctor that accepts Medicare. So if you're traveling a lot around the United States, maybe that is a better option because there will be Medicare doctors everywhere versus if you're with, I don't know, Kaiser, I don't know if that's a Pacific Northwest thing or, there are probably Medicare Advantage carriers that are more regional. Is that correct?
Yeah, there are some Medicare Advantage carriers that are in almost every state in the continental United States at least, and many of them, their plans will allow you to go any of their doctors and count it as in-network anywhere in the United States. That's something that is just happening. I mean, things are evolving quickly with Advantage plans to make them more competitive with the supplement plan. And that's why people that can only sell supplements are getting worried. I mean, it is amazing what's happened in the last 3 years, how Advantage, but this is the first year that Advantage plans there's been more Advantage plans than supplements that people have.
Yeah, I've read that it is definitely growing. I know I get the AARP magazine, so I see, their comments on how much Medicare Advantage is growing. But I want to get into this expat part of the conversation here. And, with living overseas, is there a requirement that I come back to the U.S.? Like, how can I really live overseas and be on a Medicare Advantage plan?
I think the question that I have people ask me a lot of times is, how long can I continue living in Mexico? That's a big one, thanks to you.
Yep.
I tell you, you are very popular. That's why I appreciate doing this with you. I like hanging out with popular people. But anyway, how long can I continue my Advantage plan while I'm living overseas, living in Mexico? And the answer is indefinite. But the strategies must be correct because you must maintain your residence in the U.S. at the same time. And you've got to be careful about that. See, indefinite does not mean that we don't have to return to the U.S. at specific times. It means that if we return at the correct times, we can keep it continually and know that it's in force and know that we're safe with it and know that we're in compliance. And compliance is a big thing with Medicare all the way around. You don't want to get out of compliance because you're the one that it costs, not them. Now, you may find a hybrid company out there, but I want to just talk about something for a minute, and that is the misconception of the 12-month idea. You see, the reality is that other than maybe a hybrid plan, and I haven't seen it, but I've heard it talked about, that comes from an employer, the general provision set by Social Security is the ability to be out of your service area, and the way it states it is up to 6 months per trip, and that's whether it's an HMO or a PPO. And Social Security is really the instigator of that. So let's address something that's happening in Mexico. I had probably 10 clients call me this year, different people from around the United States, that wanted me to work with them. And they told me, oh yeah, my neighbor in La Paz told me that his plan will allow him to be out of the country for 12 months at a time. And here's what I told all of those people. I said, do it very nicely, because this is very important to your neighbor. And that is, ask them to show that to you in their contract. And the reason I do that is people need to know what's in their contract. Because you don't want to think you have 12 months and 9 months later, you've been out of the country for 9 months and you have a $60,000 aneurysm and you turn in the bill to get your reimbursement and find out that, oh, Not only are they not going to pay my claim, they're going to cancel me because they say that I've been out of compliance with my contract for the last 3 or 4 months. You see, people think there's a misconception about a 12-month plan. I even heard a fella make it real clear on a video and named the carriers that had the 12-month plan. And I went ahead and pulled it down, sent him the information on it so that he would know. You see, some plans will allow you to be out of your area up to 12 months. And they base that on a visitor traveler benefit. That's what it's called. In fact, Social Security is actually the one that authored that for people that were going to be wanted to be out of their area for over 6 months and still maintain their residency. So we've got that. So people see that visitor traveler benefit. That's all they hear about is the 12 months. And they go off to Mexico thinking that they're in great shape for 12 months. However, there's a small little 7-word phrase that this gentleman missed and too many people have missed. And that is, it says, your visitor traveler benefit is specific to our area within the United States. Now, if you try to use that overseas and claim you have 12 months, they'll laugh at you. Because you got to realize what we're dealing with, Brighton, and some people don't realize this, is contracts. When we're working with Medicare, no matter what plan we go into, we're dealing with contract law. And the carrier sees it that way. We may not, but the carrier sees it as contract law. And they will normally perform to their end of the contract. But they're also going to expect you to perform to your end. And if you're out of the country for over 6 months at a time, and then you file a claim on your Medicare Advantage plan, you're probably going to hear your carrier say something like this. And that is, your claim is denied and your plan will be canceled for violation of your contract. It's that simple. We can't do it. Now, here's what I tell people. They say, and this is a concern people in Mexico have, and I understand it. What if I don't get back for 9 months? What's going to happen if I'm in Mexico and for some reason I can't get back and I don't come back into my area for 9 months? And my answer is, that's not really an issue. The issue is whether you filed a claim after 6 months while you were out of the country. Because if you come back into the country and you see a doctor in the country, there's never a question asked about how long you've been gone. And not only that, it resets your plan and you're ready to go again for another 6 months. The problem comes when we're out of the country for over 6 months and we have an issue and we file a claim. They're going to ask us, how long were you out of the country and how can you prove that? And the reality is, if we were out longer, we can't prove that. And so we're denied. And it happens. I've had it happen to a couple of folks in the last year. I mean, it's just, they don't want to pay if they don't have to. And they'll pay according to their contract, but they're not going to pay if you violate their contract.
You know, because I mean, Medicare Advantage plans all have different rules. There's something, I think you said 2,000 or something like that. So if someone's living down in Mexico, and to make sure that they are covered, like always covered, they need to return to the U.S. every 6 months just for a day or something, visit the grandkids, something like that, just because that is what resets the clock on their Advantage plan.
Here's my whole philosophy. It has been all my life, and that is not try to get as close to the line of violation as I can get and live, but to stay as far away from the line as I can and still live comfortably. I think that's a smart way to live. I don't want to push it, but I don't want to give it away either. What I tell people, and I think this makes a lot of sense, is every time you come back, call ahead of time, email ahead of time, get an appointment. When you come back, go in for a checkup, go in for your yearly maintenance, go in for whatever. Somehow use your plan while you're in the area. You know, Advantage plans, about 99% of them, it doesn't cost you anything to get blood drawn. It doesn't cost you anything to see your primary care doctor. So you see it. Here's what happens. You've been out of the country 5.5 months and you file a claim in Mexico. They're going to say, how long have you been out? You say 5.5 months. They're going to say, prove it to us. Show us. We want some evidence. Unless they don't even have to ask you the question, because the first place they look is he active with his plan? And if I've been back within 5.5 months and it shows right there, I saw a doctor, they're never going to ask a question of me. They're going to pay the claim.
But theoretically, you could use something else that proves you were there. You just have to go through the process now to prove that you've got pictures of yourself at Disney World or something on your Facebook account or to stamp in your passport, something.
That's not the issue. I just say, why should I want to have to prove it when I really don't? And why not see that doctor? It costs me nothing.
So let's maybe break that down by, the different types of plans, because you mentioned that some people might want to change their plan because some Medicare Advantage plans may not cover you at all overseas, but the maximum is 6 months that you can be out of the country for any plan. Is that correct? Okay.
Yes.
Okay. So choose the right plan, but always have a schedule to just pop back into the U.S. And that's the beauty of being in Mexico. It's a lot harder if you're in Southeast Asia to just hop back. And that's a big.
Yeah. You know what? I've got two people living. I got a couple of people living in Latvia that do it. I've got people that live in, over in Spain and Portugal. There's quite a few people that do it. If they don't get back in 6 months, it's not the biggest issue in the world. I just tell them that after you've been out of the country for 6 months, just figure you have no coverage anymore. Don't treat it like you do because you'll get in trouble with it. So when you do come back, it'll reset and you'll be ready to go again. Here's the issue though. You've got to be careful because all of them almost will say up in their advertising, or that's what I like to call their first brochures, is zero this, zero that, zero these things, and zero that. They don't say, and then this is what it cost you in here or there. But they'll say, yes, worldwide emergency coverage. You have to go into their evidence of coverage, which is a large legal document. And you've got to search that through so that you can find where it talks about it and where it shows it, and make sure that it's for a copay, that's all you pay, that you don't pay any coinsurance on top of it. And here's the real stickler. There are several of them that have either $25,000 or $50,000 limit on your coverage. And now $50,000, you might get away with it. I have a fellow is in Mexico right now. He just had some problem with an aorta. That is $64,000 to get the repair. And that's in a hospital in Mexico. Now, the issue with that is if you're on one of those $50,000 ones, you're going to pay the last $14,000 of it. That's a lot better than the 64, no question. But why not be on an Advantage plan that covers you? I say look for the one that has the copay, no coinsurance, no limits on coverage, and will allow you to stay out of your area for up to 6 months per time.
Well, so then the next kind of thing that popped up was residency. That you have to be a resident in the U.S. How do you maintain residency in the U.S. so that you are legitimately eligible for Medicare?
Social Security did this little one-page paper. I put a link in the notes that I gave you if you want to put it on your website. It's just a little one-page thing. That gives the definition of what they're looking for residency. And realize, as Social Security goes, that's how Medicare goes. They are the ones that run it. If you change your address with Social Security, it changes with Medicare. So the two of those are always hand in hand. So what they say is that U.S. residents, their definition for it is an individual who establishes residence in the U.S. with the intent to continue living within the geographic limits of the U.S. Now, the thing is, the description of residency with them is almost always a U.S. mailing address. That's their residency requirement, and that's actually the residency requirement for your Medicare Advantage plans, is they want a resident address. They won't take a P.O. box. Now, people are using these boxes that are actually a mail ship center, and there are some good reasons for that. I've got RVers in the United States that have no place to live. They live in their RV and they live in a park when they're back, and they're gone all the time. And they still have Medicare Advantage plans, and they do use one of those boxes, so it can be done. You just want to be, kind of careful with it. Here's something that's interesting that they say. Absence from the U.S. less than 6 months with no intention of abandoning U.S. residency does not terminate or interrupt an individual's period of residency. So there's that 6 months again. And that's where that's where Medicare bases it on. But here it goes on to say absence from the U.S. for more than 6 months is not considered temporary unless there's a strong indication the individual is maintaining U.S. residence, maintaining a house or apartment in the U.S., paying U.S. income taxes as a U.S. resident, or while they're abroad, or other similar acts and indications of maintaining their residency. So it's not that you can't be gone for longer than 6 months and maintain residency. It's just that you've got to keep it in order pretty good. See, a person doesn't have to reside in the U.S. for any minimum period of time to be considered a resident. So it's not a thing of I have to be in my area for 6 months at a time. No, I just can't be out of my area over 6 months at a time. And that's the way all the plans read now. It didn't used to be that way, but it is now.
So yeah, that's a great point here. These are subtle things that are in contracts, and I think this is why someone like you, who specializes in expats, can help to walk people through this process, because it is tricky. And if you are saying, you know what, I'm never going back to the U.S. and I'm ready to, and I've sold all my stuff and I've disowned my family and all those things, like those are pretty good signs to the government that you are no longer a U.S. resident, versus maintaining relationship with your family, going to see your kids in the U.S. It's pretty common for people in Mexico to go back to the U.S. when the weather gets not so great, and go to weddings, go to funerals, all those types of things. So all those signal to the U.S. government that you really are maintaining your connection to the U.S. It's not that you're gone forever.
Yeah. And it is possible to live outside the U.S. and retain your local residency, but I tell you what, it is a strategy that's got to be carefully considered. You need to consider your addresses. One of the things you certainly don't want to do is renounce your state income tax. So, I have people that will take out residency I have a gentleman that did it in Costa Rica and then filed for a Medicare Advantage plan in his state. Well, when you really get right down to it, that's Medicare fraud and tax evasion. And so you got to really be careful with those type of things. So if you're going to move out and say, I'm gone and I'm changing all my addresses and everything, then, just figure, yeah, that's fine. And you can keep A and B. They don't care. The only issue is you can't have an Advantage plan or a Part D plan. The thing is with those people is if they do come back to the U.S. later, if you've got your Part B in place, it doesn't take any time at all to get into Advantage plan. You come back in on the 28th of March and you can have it April 1st.
Yep.
You can apply and have it the first day of the next month. So that's not a problem. Just don't get yourself in trouble with it. Social Security lists 12 established, what they call 12 criteria for establishing convincing evidence that you're maintaining your residency. You want me to read you a couple of them?
Yeah, let's read on. So these are you don't have to do all of these, but these are things that they look at and they're like, you got some of these?
Even Social Security suggests that you have at least 2 of these in place.
Okay. Yeah.
And you'll find it's real easy. You own property or you pay income tax and you've got forms for property tax or income tax. If proof of U.S. ownership or a rental lease or rent payment records, utility bills that are addressed to the claimant, a U.S. driver's license. I tell people, how hard is it to keep a U.S. driver's license if you are going back? Well, make sure that if your residence is in Texas, don't have your driver's license hanging out in South Dakota.
Yep.
It's better to have them together and have it at the area that you're claiming as your address. A telephone directory listing. Who has one of those anymore? I mean, you tell me that's not okay. Regular and frequent participation in social programs, proof of employment, the pay stubs, proof of active participation in religious or fraternal or social organizations, a record of volunteer. Now, here's a cool one. clinic cards or doctor's records showing dates and visits on for regular medical treatment. That's one of Social Security's. That's not Ron's, but that is by far the easiest way to keep everything in order with them. Proof of a local U.S. bank account. I don't know very many people that move to Mexico and don't keep a bank in the U.S., still keep a bank account in the U.S. You almost have to, the way credit cards and everything are set up. And so have that bank account in the same address, at the same address as the location that is your residency. It's proof of residence.
Yeah.
Correspondence with the address and the claimant. So there's a lot of things there. One big flag that you don't want to do is you don't want to move overseas and have an Advantage plan and change your Social Security address to your overseas address. You could say it's a game changer. I think it's game over. You know,
Okay.
if you're going to change it, there may be a reason to change it. Maybe you want to have so just drop your Advantage plan. Pick it up when you move back.
So yeah, because Social Security will deposit your check into a Mexican bank account, but what you're saying is keep your bank account in the U.S., have Social Security, connected to that bank, and then transfer money down to Mexico between banks. That kind of.
That's the best way, but at least have your Social Security address for correspondence and everything. Have it located where your residence is, and then you can still have them send to a foreign bank.
Okay.
That isn't changing your address. I don't know that I would do that because there again, I want to stay away from the line instead of encroach on the line. I'd rather have it just, bonk, bonk.
Yeah. Yeah. Well, maintaining that U.S. bank account, it does show that your intention is to still maintain your connection to the U.S., that you're planning on moving back at some point, and that's it. This is not a denouncing your citizenship and going away thing. This is you're still connected. So that is great advice. And this is something actually I've got someone talking about getting married down here, and looking at like what is that legally going to do to her in terms of her residency and tax status and things like that. So there's a lot of like things that need to be planned out. So, and Ron can help you plan that out. So let's move on though to there's, I think maybe one or two other times that people can change their plans. Let's like the moving, when you change your address, let's cover that first, and then we'll go on to your initial enrollment, because there's going to be some more talk about not missing that deadline.
Yeah, there are special enrollment periods for Medicare Advantage plan. One of them is called the MOV, which is moving special. It's your moving election. So if you're living in the U.S. and you move from North Dakota to South Dakota, and your plan isn't in both areas, and it probably won't be. You might have the same carrier, and it may even be the same plan, basically, but you have to relocate it when you move. And you have a month before and 2 months after you've moved to be able to do that. Now, a lot of people I talk to, you cannot believe how many people I've talked to this year that are looking at moving in the spring of the year to Mexico. Thanks to you, Mexico is on there. I mean, I talk to them all over, but that's a big one, and thank you for that. But they're going to be moving to Mexico, but they want to. But they've sold their property where they are, or whatever reason, and they're going to be moving in with their son or their daughter or their sister or their aunt or their uncle or someone else before they go on down. Well, guess what? That move done right, do it just before you leave, or consider what you need when you go, because when you make that move, you've got a special enrollment. You can change your Advantage plan, and you can pick up an Advantage plan that has the right coverage for your living out of the country. And so that move is a great opportunity for people to still use, even for what we're doing.
So then there's the initial enrollment period. So
Yeah.
talk about this. This is probably maybe, not specific to expats. Well, yeah, I guess specific to expats, because some people in Mexico, some people will decide not to essentially get original Medicare. There's a little bit of a cost involved in that, I think, right? And so they're like, okay, I don't want to pay that. I'm going to get IMSS or something like that, the basic medical coverage here in Mexico. They just are going to go and, roll the dice type of thing. So, but they, and they save some money because they're not paying Medicare or anything. after they turn 65. Talk about that a little bit about is that a good idea?
Yeah, there's a lot of people living in Mexico that are under 65 because, well, there's even people down there that teach moving to Mexico, retiring early, moving to Mexico.
Yep. But say they
Yeah,
turn 65 while they're here,
they're
and
turning
they're like,
65. What do you do? One thing is if you qualify, and qualifying for Medicare, you have to have worked for 40 quarters during your lifetime in the United States and be a citizen or having lived here for five continuous years. When you turn 65, you have an option. It's called the initial enrollment period. It starts 3 months before you turn 65, the month of your birth month, and 3 months after. And during that time, you can choose any Medicare supplement plan, Advantage plan, anything you want if you pick up Part A and B. Now, that's the time that you pick up Part A and B, and I say always pick up Part A. It's free. If you qualify, Part A costs you nothing, and that's hospitalization. So get it. And that way you've got your foot in the Medicare, in the Medicare pot anyway. Costs you nothing. Some people say I'm not going to do Part B because it costs $174 a month. So people say $174 a month. Yeah, that's if you're on an Advantage plan though, that's the full cost of your premiums for your for Medicare in most cases. So that's really reasonably inexpensive. But if you're only on A and B and you're living overseas, you can't use it while you're overseas. So they don't want to take it. There's a couple of issues that you've got to watch out for there. Number one is, what are you going to do when you come back and visit the United States? You have to pick up travel coverage every time, and you better do it. This is not a country that you want to be in and not have adequate coverage. So if you don't have Part B, you don't have anything covered for emergencies, only for hospitalization. So that's number one thing. Number two is, if you don't have Part B, you can't get an Advantage plan and you can't get a supplement plan because the requirement for either one of those is that you have Parts A and B of Medicare in place. But here's the real issue. Let's say I'm never coming back. I hear that from so many people. I dealt with a couple about 3 years ago that they had been out of the country for 10 years after they turned 65. They had got their Part A. They hadn't got their Part B. They were never going to return, but he died, and the kids in California made, in a lot of ways, they made mom come back to the U.S. She was up there in age now, and she had some physical issues. The problem with that is she came back in March. And when you come back in March, if you don't have Part B, you can't pick it up again until January 1st, the 1st of January, and it'll start February 1st, and that's the earliest. So she came back into the U.S. not exactly well, and she had to go from March all the way at that time. She had to go all the way past July, clear around to the next July, because it was only 2 years ago that when you signed up in January, it started in February. It used to be January, February, March is the general enrollment period, and your coverage started July 1st of the next year.
Wow.
So, but she had to go all the way to the next July, 15 months, with no coverage in the U.S., and she was sick and almost bankrupt 3 families.
Wow.
So, if they would have just taken out their Part B, she would have come back. The day she entered, she would have signed up for an Advantage plan. She came in on about the 25th. 5 days later, she'd have had 100% coverage and been good to go. But to add insult to injury, she had a 10-year penalty to pay also. Because if you don't sign up for Medicare when you become eligible for it, and you are eligible for it when you turn 65 overseas, doesn't matter that you're living out of the country, you became eligible. If you don't sign up, you start right then accumulating a Part B late enrollment penalty of 10% of that $174 a month for every year. So she had to pay the $174 and an extra $174 for the rest of her life. It doesn't fall off. So, you can weigh it out. Now, there are some people, I've had some people that I've done some calculations with them and said, you know what, you shouldn't take your Part B. And it's because they are high income earners. And some high income earners have to pay an extra amount for their Part B, and it can get very expensive.
Oh, interesting. Yeah, but this is great. Once again, reason to talk to an expert specifically about your situation.
Yeah.
Feel free to leave comments for me, but Ron doesn't read the comments. So, if you want something, if you have something you want to talk directly to Ron about, reach out to him. Yeah, I'm wondering, is there anything else that we haven't really covered here?
One of the things that we haven't looked at, and we probably ought to for just a moment, Brighton, is the fact that people may still be working and they may have coverage through their employer. How do they end that, and when do they end that? And the reality is you can, if you're over 65 and you're still working, you don't need to take Part B. You should take Part A because it's free, but you don't need to take Part B. You won't incur any penalties as long as when you get to the end of either your employment or your medical coverage, whichever comes first, you go ahead and then sign up for your Part B. Otherwise, from that point, when one of those two quits, you will start accumulating the late enrollment penalty. Now, there's something a lot of people have got to watch, and that is COBRA. They want to go on COBRA for a period of time. Well, don't do it for over 8 months, because that's all the longer your special election period. Once you stop work or you lose your coverage, you have a full 8 months to get to get your Part B. But if you don't get it before that, then you start accumulating, issues. And COBRA and retirement plans from companies are not creditable coverage with Medicare, so they don't keep you from accumulating the Part B. The one that a lot of people run into is when they retire, they can go right on with their insurance after retirement. It doesn't even skip a beat hardly, and they just keep right on going with it. But what they got to realize is that lost creditability with Medicare when they left the company or when they switched over to that retirement plan. And if they do need to drop it in the future, or if the company drops it in the future, or if it gets to where it's expensive in the future and they want to go into Social Security, go into Medicare Part B, then they're gonna be costing them, because they're gonna have to sign up and they're gonna have the late enrollment penalties. So just stay with the plan. When you lose coverage or you lose employment, go ahead and make sure you get right on your A and B of Medicare.
So I guess theoretically, if you are working down here past 65 and you're a consultant or something, I say there's a lot of people doing that, and you're an employee, as long as your employer is providing you with health care, you don't have to have Medicare Part B. That's the one that you'd have to pay for, and you don't have any penalties. Once you sever that relationship, or once your employer stops paying for health care, maybe you dip down far enough below 20 hours a week or something, and they're like, okay, well, that's no longer healthcare. That's the point at which you need to get on the Medicare system.
Yeah, either that or just figure you're gonna be owing penalties.
Well, thank you so much, Ron, for sharing all this knowledge, and thanks to all of you for watching this. If you have a specific question, reach out to Ron directly. Feel free to leave comments down below, and I'll see those and probably reply, but reach out to Ron directly. His contact information is going to be down below. Everyone has very specific situations, so you're going to want to get the details for you. So I've got something to share with you for making it to the end of the video. I've got 2 gorgeous little puppies here looking for homes. These are our new foster dogs. So thank you for making it to this point. And I've got videos for you too. I've got up here the original video with Ron covering Medicare Advantage for expats. And then down here, some videos about other expats and their experience in Mexico to inspire you to make the move sooner rather than later. Hasta luego.